Okay, this is a lecture series on the musculoskeletal system and various conditions that affect the musculoskeletal system. We'll be looking at limb deficiencies, club feet, club hand, various fractures, OI or osteogenesis imperfecta, scoliosis, juvenile rheumatoid arthritis, and a few others that I have thrown in there. Because it takes so long to upload video content and voice over lectures, I'm going to break this down into smaller chunks. Hopefully you guys can understand the types of limb deficiencies, define and discuss osteogenesis imperfecta, scoliosis, juvenile rheumatoid arthritis. We'll look at medical management and OT interventions for all of these as well. Looking at limb deficiencies, they can often be caused by something traumatic that's occurred, pathological, or congenital. And so traumatic is when something like an accident happens and somebody then loses a limb because of that. I think I grew up in a really rural farming community, and so it wasn't too uncommon for people. It seemed like every year somebody was getting their arm stuck in a piece of machinery or something like that. They are making more advances in reattachment surgeries, and so we are seeing less traumatic limb deficiencies because of this. But they're still out there. Pathological limb deficiencies are related more so to physical illnesses. And so when we talked about cancers, we talked about osteosarcoma. Osteosarcoma is a cancer or a tumor that grows in the bone, and there's no treatment other than to amputate that particular area. And so you'll see pathological, or an example of pathological etiology would be that amputation to remove that tumor. Congenital limb deficiencies occur also, and you'll see malformation in hands and feet that occur 1 every 600 live births. So this is something that is fairly common. Sometimes it's not that big of a deal at all. It's very common in upper limbs. It can be caused by teratogens, such as various drugs or viruses that the mother who's carrying the fetus is exposed to. It can be caused by different metabolic diseases. Maternal diabetes is one common metabolic disease that sometimes has effects on limb deficiencies. And then congenital constricting bands is also something that occurs or can occur. And what happens there is when the fetus is in the womb, bits of the amniotic sac rupture. And then this fibrous amniotic sac, portions of it are floating around in with the fetus. And so what happens is it becomes attached to maybe the fetus's arm or leg. And then as the fetus grows, these fibrous bands do not grow. And so it essentially is like a rubber band cutting the circulation off. And you can see partial amputation, or you can see some other types of evidence that maybe the limb is smaller in the area where the congenital constricting band was located. Please refer to your Case Smith book in your reading assignment, because there are very, very, very good pictures of different things as well with limb deficiencies. Looking at congenital limb deficiencies, it can occur as amelia. And so when we just break apart these terms, a means without or absence, and melia means limb. And so amelia, the type of congenital limb deficiency, amelia, means that one or more limbs are missing. Phocomelia is when just a portion of the limb, the proximal portion of the limb, is missing. Paraxial deficiency is the proximal part of the limb is developed, but the medial or lateral side of the limb is missing. And then transverse hemimelia, a portion of a forearm or hand or part of all the fingers are missing, or portion of the distal lower extremity is missing. So here we'll see some examples of phocomelia and paraxial deficiencies. So again, amelia is absence of one or more limbs, but phocomelia is that proximal portion is missing. Okay, and so that's there it is. I have a little pointer here. So that's this. The proximal part is missing. So on the arms, he has his shoulder, but the humerus, radius, ulna, those are all missing. And then same thing down here. So that would be your phocomelia. Paraxial deficiencies. Again, the proximal limb is developed, and so you have the humerus here. Okay, the proximal limb's developed, but then the radial or ulnar side is underdeveloped. And so you can kind of see how it's a little bit smaller here, or the hand is a little bit underdeveloped. And so that would be a paraxial deficiency. Looking at transverse hemimelia, portion of the forearm or hand, or part of all the fingers are missing. Here we go. And so again, transverse hemimelia, we have missing forearm here, or a missing hand down here, or this part here as well. So what do we do medically and as OTs? We do a lot of prosthetic training. So what they say is prosthetics are usually fit for a child by at least 6 months of age, because as they're developing, we want them to be able to integrate that prosthesis right from the get-go, because at 6 months of age, they should start to be reaching at midline, they should start to have that bilateral integration, and those sorts of things. And so it's been studied that if a prosthetic is fitted after 2 years of age, there's a greater chance the child will reject the prosthesis. But if we can get them at a young age, at 6 months, then there's a greater likelihood that they're going to stick with it. Lower extremities, they say that the child should be fitted at the time of the amputation, or at the time of ambulation. And so we know that, at around 12 months, 10 to 12 months, children are starting to walk. We want to consider the terminal devices. Terminal devices range from hooks, range from different pinchers. So they're the actual tools that are on the prosthesis themselves. And then we definitely want to consider the growing child. So we might not want a super complicated prosthetic at 6 months of age, right? But as the child grows up and they're learning more functional skills with their prosthetic, maybe they're going to get a more complicated one. For OT intervention, we want to encourage bilateral activities as much as possible. We want to teach prosthetic application, so how to don and doff their prosthesis. And we want them to use their prosthetic for ADL skills. Here are some pictures of different terminal devices. So we have our hook, we have our hand, we have different attachment devices also. And I'm going to post that and take a little break.